Hello everyone, welcome to another edition of For the Health of It. I'm your host, Lou Beccaria. Glad to have you with us. Our For the Health of It topic today is rehabilitative healthcare. Here to speak with us about it is the Director of Rehabilitation at the Phoenixville Hospital Tower Health, Holly Younker, and Peter Hales, the Supervisor of Rehabilitation Healthcare. Rehabilitation healthcare is a specialty that you should know more about, and Holly and Peter are here to tell you all about it and how rehabilitation services at the Phoenixville Hospital can help you if you ever need it. So let's get to it. Welcome, Holly. Welcome, Peter. Thanks for taking time out of your day to be with us. So first, let's tell us a little bit about yourself. So, Holly.
Well, I'm the Director of Rehab at Phoenixville Hospital. I am in charge of the therapies and the rehab unit on the second floor. I've been at the hospital for about 33 years. I started as a student and stayed and worked my way up to director.
Oh, okay. So we've got longevity.
Yes.
Peter, how about yourself?
I came to Phoenixville Hospital 6 years ago, just prior to the rehab opening. Prior to that, I was at another hospital. I've been an occupational therapist by trade for 11 years, graduated from Temple University, and came to Phoenixville Hospital for the specific reason to work in the rehab.
Wow. I'm curious, what attracted both of you to rehabilitative medicine or healthcare?
It's an interesting question.
There's so many varieties of things that you could concentrate in.
I think a lot of times people who are attracted to healthcare have had a history or something that has happened in their life. My father was disabled, and I had to work with him as a young person, and I helped him through some of his disability, and it led me into this career.
Okay.
Yeah.
I have a similar story. My dad was sick, and I had to help him get over a couple challenges, and I knew that it was something that came right to me, and I knew that I was a helper. I knew that I understood the body and how the body worked. And then, after working in rehab for a little bit, I thoroughly enjoyed the ability to make an impact on somebody's life in a very short period of time.
Mm-hmm. So you both like to be in a helping kind of a mode.
Yeah, we are helpers by nature.
That's good. So tell us, each of you, tell us about your particular role within the rehabilitative healthcare program at the hospital. Holly?
Well, I'm a physical therapist by trade, but at the hospital I am the director, so I'm in charge of the program. We have a great program, and I'm in charge of all the day-to-day activities, making sure that everything is going okay, making sure we're, hitting our numbers and doing the best job we can for our patients, helping out in any role necessary to do that.
Okay. And Peter, how about yourself?
I also assist with the day-to-day operations. I manage the therapist and try to assist with whatever questions or concerns are raised, and under the direction of Holly, help with the development of the unit and the promotion of the unit, and helping to get our name out there and make awareness of what services we offer at the hospital available to the public.
So your program, is it both for inpatient care as well as outpatient care, or just one or the other?
Our program is an acute rehab program, and that means by nature that it's an inpatient program. In our unit, there are 14 private beds. It's all inpatient. They stay overnight. They're there for the duration of their care, anywhere from 7 to 14 to 21 days, depending upon the patient's diagnosis. So, yeah, inpatient only.
Yeah. So, Peter, what are some of the kinds of situations medical situations that people have had that would require 7 to 14 or 21 days to be in your facility?
The large majority of the patients we see are patients who have suffered a stroke or are experiencing a neurological diagnosis. We also take patients who have just been debilitated or have been in the hospital for a prolonged period of time and have really gotten weak, who need a tune-up and need to get back to their functional level, back to the level of independence so that they can get home and get back to their lives. So really it's about the patient, the patient that had a stroke, the patient that came into the hospital under an emergency event. Maybe that patient had to stay in the hospital for a couple days, got weak and deconditioned. That's where we would take that patient onto our unit and help them get stronger and back home.
Okay. So staying with that for a second, what are some of the typical kinds of things that you would do for rehabilitation with somebody who had a stroke or had a heart condition and needed rehabilitation?
So our job is either to help teach our patients to compensate for whatever deficit it is that they're experiencing, or to rehabilitate that deficit or remediate that deficit. So depending on the patient, depending on the specific context and the situation of the patient, our therapists will work with that patient to either regain the ability to use some of those functions that have been limited, or compensate for the fact that those functions are limited. There is no better way. It's really about what works best for the patient and what's going to make that patient the most successful at home.
Okay. Yeah. How large is your unit or your department in terms of the number of patients that you could care for at any one time?
It's a 14-bed unit. There are 14 beds. It's private. It lends to the fact that it's a very intimate atmosphere, meaning that everyone knows each other. You have a group of therapists that you see every day. There's a small group of nurses. So the patients get really familiar with the staff, and it becomes a really nice learning situation, a really nice atmosphere where the folks are coming in to visit with you and to help you out. We have
It's a very close, it's a very tight-knit team. And the beauty of our unit is that we're small but mighty. We're 14 beds, but those 14 beds, those patients are seen by the same therapist every day.
Right.
There's a great continuity of care provided. And I think as a unit and as a team, the one thing that we're all focused on is being excellent and providing excellent care. Not average, not just above average, but excellent care.
Right. Does the rehabilitation care that take place just during the day, or do people get therapy during the night, before they go to sleep? How frequently is it administered during the day?
The therapy, physical therapy, occupational therapy, and speech therapy all happens during the day. But remember, it's an acute rehab unit, and to be on that unit, you require not only physical therapy and occupational therapy and speech therapy, but you also require nursing care. So it's a 24-hour caregiving facility, just that therapy happens during the day. And in our unit, a patient must receive 3 hours of therapy a day, and that's any combination of the three therapies. They can have an hour of each. They could have an hour and a half of PT, an hour and a half of OT, or they could have speech and OT, but it has to be 3 hours a day, and they have to meet the criteria to come into our unit.
Why is it 3 hours a day? Is it something related to insurance, or just that's what good therapy is?
It's an intensive level of therapy, which differentiates us from a different level of care. We're a higher level of care, which provides that intensity of service. If you go to another level of care, it may be a lesser level, but that's what the patient can tolerate. That's what separates different units.
And the 3 hours is a minimum. It's a requirement that is Medicare-based, of course. That 3 hours, is kind of just a guideline, and we try to shoot for, if possible, more than 3 hours, and try to get that patient the most intensive therapy experience as possible.
So it is a minimum.
Right.
Yeah.
Correct.
Okay, we're going to take a commercial break right now. Folks, we've been talking with Peter Hales and Holly Younker from the Rehabilitation Healthcare Program, inpatient program at the Phoenixville Hospital Tower Health. We're going to take a break for commercial, and please stay with us. We'll be right back for the second portion of the show. Hello everyone, welcome back to For the Health of It. For those of you who are just tuning in, we have the pleasure today of talking with Holly Younker, who is the Director of Rehabilitative Services for the Phoenixville Hospital. And we are also talking with Peter Hales, who is the Supervisor of Rehabilitative Healthcare Services at the Phoenixville Hospital. So I'd like to ask you, as we start off the second portion, the psychological aspect of the the rehabilitative healthcare. You described earlier that the people that you deal with are people that may have had a serious heart issue, a stroke, and so forth, and it's a big attack on their life, so to speak. So, what kind of psychological help do you give people who are in that situation, that they're not only dealing with their physical problem, but it's a psychological difference as well?
We have a psychologist who comes to visit the unit, and she comes each week, and we do put in consults for the patients to be able to talk to them. It is really important. It's a major part of their life. It's a life-changing event, not only for themselves but for their family. So we do have them see the psychologist. If there is something where they need a change in medication or something, we have psychiatry come in to visit the patient.
In addition, in addition to the formal psychology services, because of the intimacy of our unit, because of the continuity of care provided by the team members, there's an empathetic approach, I think, that's used by all the clinicians. And when you see somebody day to day struggling, and you see something that you can help somebody overcome, whether it be therapy related or nursing related or just life related, we have a fabulous team of clinicians who are willing and able to really use that empathetic approach to help our patients overcome some of those issues.
Yeah, I think that's really important. So you're kind of a motivator as well.
Correct.
In addition to all the physical therapy things you do. So describe for me, Holly, your team. Who makes up your team?
Well, we have the medical director. We have the cast and crew of the physical therapist, occupational therapist, speech therapist, nursing. We have a nurse practitioner on board, the psychologist. We have, who am I missing? Our admission liaisons. That how do we forget them? They admit our patients into the unit, and we have a person who's in charge of all of our transferring of information to CMS, so that everything gets logged in and we do everything in order to receive information about our outcomes.
Right. So if a person has been in your unit receiving care for 7, 14, 21 days, is there an aftercare part of what you do once they leave the hospital? Can you tell us about that?
That's a really good question.
Yeah.
We the aftercare is probably one of the more important components of the rehab regimen, so that we're providing the services within the hospital for that time frame, whatever it may be, 7 to 14 days. Once they're getting ready for discharge, and actually we start planning for their discharge as soon as they're admitted. So we have this wonderful social worker in our team, our team that gets together and meets daily, and we come up with good discharge plans and recommendations and services that would assist the patient in making sure that that transition home is successful and safe. Once we set them up, we're making sure that the services we're recommending after discharge are specific to that patient and are going to be beneficial to that patient. So whether that patient needs outpatient services or home care services, we're going to make sure that we bridge them to those services so that they're successful.
Well, let's take the example of somebody who came in with a stroke, okay, and they've gone through your inpatient program. What would be the typical outpatient prescription, so to speak, for them to do in their aftercare? And how long would that be? Would it be a month, 2 months, 3 months?
So typically, I would say a huge portion of our patients go home with home care, and that home care is provided through a nurse and a physical and occupational and speech therapist. So they're continuing to get that home therapy, quote unquote, at a less intense level, and that's because they've gotten to the point where they're successful and have improved enough that they don't require the intensity of a 3-hour a day program. So they would typically receive the home PT, home OT, home speech, a nurse, to ensure that those skills they've learned or developed on the rehab unit are continued, and that development is continued to be fostered at home.
Right. Okay. You've used some terms that I think some of our viewers may not understand, so I'm going to ask you. What's the difference between the different types of therapy? You said OT therapy.
Great question.
And other types. What are they? How are they distinguished?
It's physical therapy. PT is physical therapy, OT is occupational therapy, and then speech therapy. Each of us works in different components of the person. Together we work on a person as a whole. We address each ability. We address their activities of daily living. What is that? That means they're bathing, they're dressing. We work with cognition. Speech works with cognition. They work with speech, obviously. They work with swallowing, things that you don't even think that would be involved. But with stroke patients, sometimes they cannot swallow. They cannot eat food. They need to learn how to do that again. Physical therapy works on functional mobility. They're trying to get the patient walking again, making sure that they can, move throughout their environment.
Our job is truthfully to make sure we take care of the whole person,
Yeah.
and that no part of that person is missed. And sometimes after a stroke, there's subtle deficits that can occur that, can be covered by multiple disciplines. So a physical therapist, an occupational therapist, and a speech therapist may all be working to address the whole person. And that's just to make sure that, our specific clinical domains are somewhat specialized to an extent. That specialization can lead to, missing parts of care. By acting collaboratively and working together, we make sure that the whole person's taken care of.
Right.
Their self-care, their mobility, their cognition.
Well, that's got to be very comforting, I think, that the way you've described your program has got to be very comforting to our viewers if they ever have to use your services, that there are so many people that make up your team, for one thing, and number two, you've emphasized several times that it's such a caring atmosphere and that you are looking out for the entire person.
Absolutely.
That's great. Now, I know that you've gotten some awards. So don't be bashful. Tell us all about the awards that you've gotten.
Well, most recently, we just achieved for the third year in a row, top 10 according to our outcomes. So what happens is all of our outcomes are measured and they go into a database which collects them and correlates them and ranks us, I guess, if you will, against, there are 868 rehab facilities that we are ranked against in the United States. And for the third year in a row, we've achieved something that's called the Top 10 Award, which is the top 10 in the nation. And as a matter of fact, this year we ended up in the 97th percentile, which puts us in the top 3% in the nation. So we really have a great program, great crew of people that work there and provide excellent care.
That's something to really celebrate, that you're actually in the top 3%. Now, I assume that you're being evaluated against other inpatient
Correct. That is only what
programs.
we're being.
Yeah.
Yep.
Great. Okay. Well, I'm going to take another break to pay the bills. And please stay with us. We're going to take a break. Hi, welcome back everyone, and for those of you who are just tuning in for the last portion, we have the pleasure of talking with Holly Younker and Peter Hales from the Rehabilitative Healthcare Services Program at the Phoenixville Hospital. And let's start off the third section here. I know we were talking at the end of the second section of the show about your high ranking, and is there anything more that you'd like to say about that?
I think we just want to add that it's really important for a patient when they come into our facility to know that they have the opportunity to get back to their home and live the life that they lived before, whether it's exactly the same or with some modifications that we've provided them. But I'm very proud to announce that greater than 85% of the patients that come into our facility do in fact return to their home.
Wow, that's great. Yeah. And I guess that's a part of the whole evaluation process, how many people are going home kind of cured. Good. We talked a little bit about the team that actually provides the services, and I assume you have a medical director for that. Could you tell us just a little bit about that person?
Our medical director is Dr. Chapis, so he's the leader of our team, if you will. He has greater than 20 years of experience. He's a board-certified pain specialist. He's a PM&R doctor, which is physical medicine and rehabilitation. He is the person who does our consults for the patients. He sees the patients every day, works on them.
He's the manager of the medical complexities of our patient. He's the one who makes sure that medically our patients maintain and improve their medical status.
Okay, great. I've been told that you have another element to your overall program that you're going to be adding, and that's music therapy. And could you tell us a little bit about what's planned for that?
Yes, we've been in contact with some folks who provide music in facilities, hospitals, and rehabs, and it's called Healing in Harmony. And Healing in Harmony they provide music, not only guitar playing or other musical instruments, but singing as well. Music is such a special way for patients to be able to kind of have that healing power of music, and I'm really excited that they're coming in to help us out with this. And we'll gather a group of folks, our patients, into our day room, and that's where the music will happen. And We've experienced it once so far as the preliminary, and it was just a wonderful event for the patients. You could see toes tapping, you could see them singing along. I mean, it's a beautiful thing, and you could see smiles on faces of patients who haven't smiled quite yet, you know, and it really brings them.
It really enhances the atmosphere.
Yeah.
It changes the ambiance in the rehab from being part of a hospital to being an exclusive type of a close-knit unit. And it really makes it feel like it's less of a hospital experience and more of this is the path home.
Yeah. And I guess for just a few minutes, they forget
They
that
forget
they're
they're there.
going through therapy, and
Yeah.
they can experience the music. Great.
Yeah.
Well, we have just about 1 minute left, but I'd just like to ask you, do you have any particular success stories that you'd like to mention as an example of the fine program that you have?
We've had, we've been lucky to have a lot of successful patients. One patient in particular I can think of is a patient that sticks out in my mind because of his stature, and he's a large gentleman, and he came in to us at a very low level, and meaning he required help with everything, from getting up out of bed to taking care of himself. After 24 days, the gentleman went home walking, talking, taking care of himself, doing, I'd say 85% to 90% of everything he was doing beforehand, despite the fact that he was compensating for loss of function in an arm and for the fact that he was completely, debilitated from the start.
Yeah.
So in a 24-day period for this gentleman, he went from requiring assist with everything to getting back home and being able to get back to his life and resume some of his life roles. So that was hugely successful to us. And then every year we have a reunion, and we were lucky enough for our patients to come back to us, and we see them, and we get to bask in their success with them and really embrace their experiences and learn from their experiences so we can get better.
Wow, that's awesome. That's really great. I do have one other question which I would like to ask you, and that is, I assume that the rehabilitation services that you provide are covered by insurances, or just about all insurances. Is that correct?
They are covered by just about, there's a rare few out there that are not covered, but most are. And what happens for that process is the liaison speaks to the discharge planner at the hospital. They talk about it, and it's all taken care of on the back end before they would even come. We know that the patients who come to our unit are covered.
Yeah, that's great. Well, we're kind of out of time, but thank you very much, Holly and Peter, for being with us. Really appreciate it. And I've learned a lot, and I assume our viewers have learned a lot as well. So thank you very much.
Thank you very much.
Thank you. Well, folks, that's about all the time we have for today. We hope that we've piqued your interest in the rehabilitation healthcare, and that you now have a better idea of the services that are available at your community hospital at Phoenixville Hospital Tower Health. Until next time, I'm Lou Beccaria. It's been my pleasure to be your host. Remember, folks, if you're healthy, you're wealthy. I'll see you next time. Okay, great.